So we're going to talk about, have a conversation shortly with Dr. James Mwangi. You all know Dr. James Mwangi. Who doesn't know Dr. James Mwangi in the country? He's the Group CEO of Equity Group Holdings and also the chairman of the Equity Group Foundation. The bank itself has an asset base of over 1 trillion shillings. It's the largest bank in Eastern Central Africa, not only on assets but by market capitalization and profitability based on the full year 2020 results, which were released just the other day. During the COVID-19 pandemic, the bank purposefully opted to safeguard and cushion the lives of staff, clients, and host communities by supporting lives and livelihoods with a number of interventions. We'll be talking about those interventions, but also looking at the life and career of Dr. James Mwangi, man who went into Equity Building Society, transformed it into Equity Bank, listed it in the Nairobi Securities Exchange. Now it's its largest bank in Eastern Central Africa. What does it take to run such an institution, number one? And then, what is it that now comes into having the human face of such a big corporation? Remember, during this COVID-19 period, like we've said, Equity was instrumental and it has been participating in doing a lot of supporting the host communities in lives and livelihoods. Dr. James Mwangi himself and his family also came in during this time and donated. He's also a member of what we call here on this show, the Harambee Committee on COVID-19. It's a board that was set up by the president, chaired by EABL MD, and it includes members such as Dr. James Mwangi and other corporate titans, captains of industry. Dr. James Mwangi himself has been given a couple of accolades. He was honored in the 2019 Bloomberg 50 list. This is an honorary list of 50 innovators, entrepreneurs, and leaders who have impacted the global business landscape in measurable ways. He was lauded for his contribution in steering Equity Bank to have presence in the greater Central and Southern African region, honored alongside environmental activist Greta Thunberg, New Zealand Prime Minister Jacinda Ardern, CNN President and Warner Media Chairman Jeff Zucker, singer and entrepreneur Rihanna, among others. He was also given the 2020 Oslo Business for Peace Award. The honorees are chosen by a prestigious award committee consisting of past Nobel Prize winners in peace economics. What they said about him is Dr. Mwangi receives the award for his business-worthy values in championing financial inclusion for all in Eastern Central Africa. He has helped achieve a social revolution by bringing banking services to people who previously had limited access to them, bolstering Kenya's GDP. Dr. Mwangi is an exceptional entrepreneur and a humanitarian. The committee sees him as a shining example of how business leaders can accelerate change and help solve the world's problems. This was according to the founder of the Oslo Business for Peace Awards, Per Saksegard. Now, this is somebody who, and we talk about this a lot of times, people who individually do something to impact and bring change. People who, of course, during the course of that, they go through a lot. People not believing, you get all these challenges, you get the naysayers, you get saboteurs, you survive, you live through it, and you still have that human heart.
Well, I mean, I think you can see that very clearly in that the work that you do on a professional level, if it's done right, it's either that it influences your personal life, or if you do it right on the personal, then it also influences on the professional. And you can't really run away from the two. If you're doing it in a negative manner, then you would see the results of that. If you're doing it in a positive way, there too you would also see the results of the same thing. And then the question is often asked then, if that can translate on a personal level and show through so positively, then why can't it also on a professional level? Why can't it then at a national level?
One of the things we've discussed in this show often is how financial institutions, the financial institutions we normally refer to as banks, often by their policies and the way they go about their business, give the impression they're not really in touch with what their customers and the base of their success actually want, or what it is that would favor them. Well, there are those who've argued perhaps some of them have an external influence and that they're branches of international banks and so forth. But even banks that are local, that has been a finger that has been pointed at them that they are not really in touch. And one of the things that I have seen, because I've followed over time the progression of Equity and what they did, it is actually a pleasant thing to come across a bank that actually does what they say they're going to do. It's a very, very pleasant thing. Because when you look at the mandate that began with the formation of the building society, to look after the focus on people who are less disadvantaged in society, and then you look at the bank, again, the focus was on that. People who are less disadvantaged. How do you get to them and how do you ensure that they benefit? The bank is going to benefit, yes, but how do these people also benefit from the banking sector? And I think if we were to look at the success, I think they didn't waver from that particular mandate. They understood the Kenyan, the need of the Kenyan the bulk of the Kenyan who actually need such services and is often not well served. And in having met it, I think the rewards that have come to them should be the subject of a study as to how it is you benefit immensely when you partner with people who are actually at the very core of your business.
Pet subject of yours.
This is a pet subject of mine because we have a government that doesn't seem to understand this thing.
No. It could be really simple, CT, and maybe we'll hear from him. It could be really simple that you see a problem, you have a plan as to how you can fix it, and then you don't just do the plan and present it for everybody to see, but you actually implement it and you make sure that it works. You're bound to see the results. It's not magic. To me, it's a simple formula of 1 + 1 = 2. But here we have an example of actually doing the legwork.
Isn't it puzzling that this simple thing that is so easy to understand is so not understood?
Some people invert that plus.
Yes.
You just put in 1 × 1. Result?
0.
1.
In this case, in some cases, it's minus.
It's
Negative.
just no change. Let's bring in Dr. James Mwangi, the CEO of Equity Group Holdings and chairman of the Equity Group Foundation. Good morning, Dr.
Good morning, Eric. How is the situation room?
The room is warm. How is the room that you're in?
Not as warm as the situation room. I wish I had.
Indeed, we'd have really loved to have you here. What we do whenever we have a guest in the studio, we give them the seat and we warm it up a little bit. We call it the hot seat. Now, what we're going to do with yours is just from remote control, we'll just warm yours a little bit.
That's really kind of you.
Let's just warm you up into the conversation. We're talking about, we'll be looking at the work that you have done, you individually as Dr. James Mwangi, and you with the organization Equity Group Holdings in supporting the communities, especially during this time of COVID-19. But for us to get there, let's just start with the thinking behind engaging the communities that you came in. When you moved into Equity, it was Equity Building Society then. And then, you started that whole conversation of opening up the doors and saying, let people come, bring your money, let's open up accounts for you. What was the thinking that you had then?
The thinking is mobilizing for a cause. And essentially what I thought is that I could provide leadership in championing a cause among the people. So Equity eventually became a movement of people who were aspiring to improve their lives, to change their lives, to acquire and to live dignified lives, and at the same time fight the adversity that confronted them most, which was poverty, ability to meet obligations like sending their children to school, acquiring and housing, and hence we created a purpose which is changing lives, giving dignity, and supporting people to create wealth and opportunities. So essentially, it became a movement of the people themselves. And essentially what I simply do is then to provide leadership in the movement. And that is why all our followers call themselves members. Don't say they are customers.
You used the word there, Dr. That's very interesting. You said you simply provided leadership. And for me also, and then I said that just before we started, that it seems like a very simple thing to do, that you had an idea, you wanted to put back or even introduce dignity in the lives of people who maybe couldn't ever afford, wouldn't even dream of putting the few shillings that they had in a bank. 1, 2, wouldn't ever think of affording a credit facility to start a business, to own a home, anything like that. And you say you simply provided this leadership. How?
You notice that our African societies are organized in a social way. And if you look at Equity Bank, it is more social than economic. And that is why it is membership, it is aspirations of dignity, it's aspirations of well-being, it's our aspiration of changing lives. You can see it's not defined in economic terms. So we really spotted social challenge within society. And Audrey, as a strategist, said social problem can be solved by an economic engine, but everything else is social. And that is why if you look at equity broadly, it may be more known, the brand is more known, for instance, with the Wings to Fly kids. It's now getting more known with Equity Afia, getting more known with financial literacy and entrepreneurship training, because it's about each individual member fulfilling their dream and aspiration. And all that we do is to enable, is to allocate capability to individuals pursue their personal dreams and aspirations. And then the aggregate of all those dreams make equity. It sounds simple.
Yes,
Yeah, it does.
you make it sound simple. Yes. But tell us, how difficult actually has it been?
It's very difficult because we, as Africans, were expected to copy and paste Western models and assume that that is what is good for us. But when we started equity, only 4% of our people could get access to financial services. So we were excluded. And so we concluded that the models that were then available were not suitable and fit for purpose for us as a community and as a society. And then we asked ourselves, how has financial services been? And if you look, when I was growing up, my late mother Grace had an account with the shopkeeper. She took her shopping on credit and only paid when she was paid her milk at the end of the month. An agency is formalization of that shopkeeper little shop banking that our people were used to. And we have essentially demystified the banking. And if you look today, 98% of all our transactions happen outside the branch. Our people are more used to going to an agency within the village, and they talk the layman's language. We don't complicate things. So banking is like sugar or salt at the village level. So that ability to demystify banking and take our traditional setup as a platform for advancing society. We can improve, but we improve from who we are. Don't copy other civilizations wholesale because they were never designed, the models were never designed for us. And that is what differentiates equity. And that was what is complex. And that is what every other bank has tried to mimic, but they have not been able to, because they just see outside, they don't understand the cultural thing. This is about relationship with the people. This is about emotions. And so culture plays a very important aspect, because we have the society's culture as business culture.
But as you've moved outside Kenya into the other countries that Equity now operates in, Have you gone to first understand the culture locally there? Is it any different from the Kenyan culture of this particular lady who sells a shop or who sells her milk? Is it different across the region?
Absolutely different. You have to customize, you have to adapt, and you have to integrate with the way of life of the people. We've just talked about agents. If you go to Tanzania, they will call it wafukara. If you go to Uganda, they call it duka. So you have to really understand the norms and the ethos of the society and really build on top of that. You don't impose your will on the people.
Do you think this, what you've described, which has worked very well as a business model for equity, and you're saying others are trying to copy, but they just don't understand it inside and out. Do you think this can also be replicated in governance, in national governance, in leadership, in seeing how best do I move my people from where we are right now to a new level as a people?
Absolute. I think it's not just about banking. Banking is really professional. When it comes to governance, we need to follow and borrow strictly from our structures that we understand, that we believe in, that we own, that we have pride in. And that then creates ownership and passion for people to pursue and to follow. So there is much we can go back. It's exactly like even medicine. When we were growing up, there were a lot of herbs. I have now come to realize that those were medicinal herbs that we then have modernized their use by extracting the content therein and making tablets and capsules out of it. But we then displaced our medicinal herbs for tropical diseases. We had grown with those herbs, we had adapted to them, they were part of us, and we condemned them and took up to other medicinal herbs from other societies, which we had not acclimatized, we had not grown into, and consequently we find the tropical diseases are now the most preference because we know the source of medicinal value.
One of the things that has been said often about the ordinary Kenyan who interacts with the banking system is that they are not good at paying back their loans. They are good at borrowing and they are happy to borrow, but when it comes to paying it back, there is usually a problem. How has your institution tackled this? And is it actually true? Or is it just something that is a figment of someone's imagination?
Our experience has been very different. At the peak, we had 1.5 million customers, constituting 42% of all loans in the country. And if you look even to date, the non-performing loan book in the banking industry is about 14.5. Equity is still at 11-12%. It has the bulk of the loans. Most of the loans are from those we can describe having rural incomes. They come from rural communities, but yet they have a better paying record than the other banks. So I don't think it is about the people not being able to pay. How we structure the product, we don't match them with the income streams. Loans are supposed to help bridge gaps in income streams, the flow of income streams, and match them with the expenditure patterns. So if you create a mismatch by imposing a product on the people, it's not the people who are not willing to pay. It is simply you have made them not being able to pay because you have mismatched their cash flow. If you look at, for instance, tea farmers, we control about 68% of all small-scale tea farming banking in this country. But we only make a one loan repayment when they get their bonus. You don't keep on taking repayment on monthly basis. So that determines the ability of the customer to pay. We don't pay by will, we pay by cash flow. And that is how you need to understand the cash flow of the borrower, saying the products are appropriate.
It sounds like magic, Doctor. It sounds like something that would, unless you were to hear it the way you explained it, is something that would never be possible ever. That it is the ability of the people that's taken into consideration when you're making a commercial decision like this.
Eric Latif. Joining us on the line is Dr. James Mwangi, Group CEO and MD of Equity Group Holdings, and also the Chairman of Equity Group Foundation, talking about the man, the banking entrepreneur, and also the philanthropist. Dr. Mwangi, as we were going to the break, Ndu was, perplexed, and we were all perplexed here when you said, look, you've got to tailor your product according to your client. And for example, saying you control the biggest chunk of smallholder tea farmers in the country who go into banking, and the products that you came up with for them are looking at their own cash flow. This sounds simple. Like you said, some of these things, when we see them, they sound simple, but the thinking behind it has actually been very, very considered. Now, this kind of thinking, CT.
Actually, I have so many things I want to ask at the same time, so I'm trying to package it so that I actually ask what I want to ask into one. That thinking comes from a lot of research, a lot of thinking, a lot of consulting, and a lot of fact-finding. Dr. Mwangi, would I be wrong in assuming that you have a very serious research setup, and that you have a very serious think tank that is part and parcel of this research, and that you also you're not that risk averse, should we say you're risk informed, and that the decisions that you make arise from, should we say, a well-informed source?
I think, Muga, you are spot on. It's very informed because we involved the members through focused group discussions. So we have very good people leading the conversations, a research team that leads the conversations to try and find what the needs are, how the client would like the products to be designed, the fitment, the environment in which they are being offered. So it is that ability to integrate the customer, involve the customer, and put the customer in the driver's seat. That approach requires humility to appreciate that you can't know the needs and aspirations of a customer better than them. And so the best way to get it right is to involve the customer themselves. And that is where then the strength of research becomes important.
Unfortunately, last year, a lot of things happened, especially with COVID. But at the same time, it presented a brilliant opportunity for you as a bank, as an institution, as an individual, to then be able to display some of the same things you've talked about now on a national level when it came to rallying support for Kenyans who then would have been affected because of the effects of COVID-19. How did this all work out? Why do you think you were called to sit on what we call in this room the Harambee Committee? Why do you think you were called upon to sit there? And how then were you able to make this work?
I think I may not be able to speak eloquently as to why I was called into Harambee, but I guess the fact that as an industry captain, and it was a call to the private sector to partner with the government, that might have given me a seat on the table. But I also guess that the 30 years that we have been learning equity has created a demonstration that we have overcome a lot of challenges. We started when equity was technically insolvent. It was ranked number 66 out of 66. And by the time the call was coming, it was the year that we ended up emerging the largest bank in Eastern Central Africa in terms of balance sheet, in terms of profitability, in terms of customer base and market capitalization in the Nairobi Stock Exchange. So people would guess we could have something to offer. But what then surprised us is when I was given the opportunity by the board members to chair the health committee of the board. And given the problem was a health issue, and I was a banker, I realized they were not looking for technical skills. They were looking for leadership, demonstrated leadership, somebody bold and courageous to confront the issue, to rally the people, and to serve selflessly, and somebody who has the capacity to involve others. And I'm glad that we called them a DIT and said, this is a medical issue. Each of the medical association, whether it's the nurses, whether it's the clinical officers, the doctors themselves, the Kenya Association of Medical Practitioners, each gave their president or chairman to our committee as a technical team. And so it's like we rallied the country when we then said, let's distribute the PPEs to the hospitals. There was no dispute that the best way was to create a second line of defense. If a personal line of defense is infringed and people get infected, there is a hospital and a doctor ready to admit. So I think it's that ability to rally. And hopefully also the 15 million customer base of Equity might have given the suggestion that our customer base would rally around my leadership.
But you also, as an individual, as a family, gave a huge amount in terms of contributions to us. And this was made public. It was not a secret about what you offered. Why did you do that?
I think this is a 1 in 100 year situation. And I had the privilege of studying 18 pandemics over the last 1,800 years. And essentially, pandemics in history has had a trail of devastating effects. And I felt I was very privileged. I'm a creation of society. I remember, as I was born into a humble family, lost my father as a toddler, was left with my widowed mother, Grace, with my 6 other siblings. She had not gone to formal school. So I would say if it was not the support of the public, I would not be who I am. And this offered me an opportunity to also pay back to society or make a contribution to protect society. We have seen the plague of the 14th century. It wiped out almost 60% of European population. It wiped almost 90% of the population in Mexico. And we felt that if this pandemic would be like those ones, one would forever feel guilty if they had the capability to support and failed to support. None of us was safe. And so devoting resources to save society. After all those resources have been given by society. So my wife, Jane, and the children were very willing and glad to sign up the 450 million shillings, 300 million given to Kenya, 500 to Rwanda, 500 to DRC. We were glad to give because we felt we were giving back to the community that had given us a chance to create that wealth. And that wealth would have been useless and valueless if community didn't survive.
Were you satisfied with the way in which it was disbursed? Were you satisfied with what you heard or maybe didn't hear in terms of how Kenyans were helped at the time with these contributions, whether it was from money you gave towards the fund or whether it was nationally collected? Were you satisfied with how Kenyans were helped?
I was part of the board, and in total we raised funds and both in cash and in kind of up to 2.7 billion shillings. And out of that amount of money, much of it was given out to support communities that were in the first 5 months of the devastation. And the COVID fund dedicated 300 million. But Equity Group, my family, Equity Bank, and MasterCard, we had raised 1.1 billion. And I must be honest, I was responsible for the 1.4 billion shillings. I'm really satisfied with how we spent that money. That money never left Equity Group Foundation. It's in the account of Equity Group Foundation. We spent it from there. And to date, we have only spent 600 million out of 1.4 billion shillings. So we still have money to support the health system for another 1.5 years, as long as that support is required. We give regularly on monthly basis a stock of PPE to the 68 hospitals that were adopted. And I'm glad, given that we have those resources, this month we are extending the support to all mission-based hospitals. About 36 hospitals from the Catholic Church and another one 32. In total, 72 hospitals. That we think, because the pandemic has reached the third crisis, or the third wave seems to be a crisis wave, we felt we should spread the support to community level so that the church becomes a partner in fighting the core. So yes, every cent can't be accounted for, but I think the greatest pride I have is the decision we made that we are not going to fall into the trap of middlemen between us and manufacturers. And we said we'll pay one for socio-psycho support to the medical doctors. We didn't need just to physically protect them, but we needed to protect them psychologically from fear, from depressionary tendencies because of experiences, case management, because they hadn't managed such a case, and that we gave them 5 million shillings. And we paid, and that system we have built will last, that 85 will last for 2 years, training and building. The rest of the money we got McKinsey, the Ministry of Industrialization and Trade, and we conducted training to 106 local manufacturers. Those manufacturers now produce everything that we provide to the hospitals. The surprising thing is that the first request bids we received, a coverall was costing us 9,000 shillings. We are now able to manufacture a better high-quality coverall at only 650 shillings. And that is why this money will be able to go much more, because we have reduced the cost by 90%. We're just paying less than 10% of what the prices are. Those prices are available now to all the private hospitals in this country. They are available to individuals. So it's set, and that is why the money could last for up to 2.5 years, because we were able to beat the greed of capitalism, a greed that wanted to make money out of a pandemic, multiplying prices more than 10 times.
Dr. Mwangi, I am smiling outwardly, and I'm also smiling in my heart as I listen to this. But the thing that has made me smile the most is the support that you have offered for psychosocial support. Now, have you perhaps considered, are you considering, are you doing, or have you thought of offering the same psychosocial support to the security forces? Because they are an arm of this government that are the hardest hit, because all the ripple effects that you hear from COVID and what amounts, somewhere along the line, the police force will come into contact with these things. If somebody dies, there's a body that has been chopped up and left in some bush, the police will come across this. And if you look at what has been in the media, and there's a preponderance of a lot of harm, very adverse effects that happen to people in the police force. And a lot of this can be attributed to mental health. Has your organization considered perhaps supporting this group of individuals?
Thank you very much, Eric. And it's amazing that
Actually, this
brought
Eric
that
is actually
issue.
called Muga.
Sorry, Muga. Muga, it's interesting, Muga, you bring this issue because yesterday we set a panel to discuss that framework. Part of our solution, we felt we could complement the government by launching Equity Afia. Equity Afia, we scaled it from 5 clinics last year. Now we have 40 clinics being run by doctors. And we realized the biggest need that Kenyans are coming to Equity Afia for is stress, is depression, is mental illness. And we felt that this was a national crisis. And maybe it's because this pandemic, because it's unknown, we don't know how to handle the fear that if you are contaminated, you get it and you might die. I think it is causing too much stress that has gone into mental unwellness. I think as a nation, we need to change our attitude towards mental health and stop stigmatizing people. Mental health is not madness, the way we typically describe it. And that is where the biggest challenge is. So people who get mental health challenges don't get support. We have not specialized in that line. And the only national hospital we have, we even call it Mazare Mental Hospital. And you can see how stigmatized, even at the level of naming the institution that deal with that disease. So we felt we could create the same platform, and that's what we are working on. Ask the same doctors that are hosting the socio-psycho support to have an open one, not just for the security forces, not our armed forces, but extend it to Kenyans, because it is the people who are dealing with isolated patients. A patient who is at home, but you can't share a room with them, and that trauma, given we are very social community, that trauma of isolation is causing a lot of mental stress. And COVID might not even be the biggest problem we'll have to deal with. At the end of the day, it's the mental stress and the mental illness that it has caused in our society. And so it needs to be urgently addressed. And as Equity Group Foundation, we have chosen to champion that cause.
Some things come changing even with this COVID. And as you were talking about the fact that, look, you've set aside this money, it is clear that what you were getting things for at the beginning of this pandemic, you can get them for much cheaper. That's why you still have this kitty that you can run back to and continue to provide the support. Things change as we go along. Just the other day, we had a conversation with Dr. Githinji from AMREF, and he told us that one of the things that they're seeing that they need now are oximeters, because people are dying at a quicker rate because they get to hospital and their oxygen levels are very low, but these are not available. Is your way of operation such that you can pivot around when it comes to a need that there is? Because there's a need for that now. Is it something that you'll be able to consider and say, these are things that we can provide very, very cheap? We have the funds to do so. Can we do it now that we see that it's a need that's there? People presenting themselves to hospital dying at a quicker rate because they've not been able to see what their oxygen levels are before that. Is it something that you would say, all right, look, we can move on into this area as well?
I think we can change. We are very lucky that we are part of a national initiative. I remember Equity Group Foundation pledged all the 1.1 billion to Kenya national COVID board. And so if the board makes that decision, and we have seen that flexibility in the board. But also we work very closely with the Ministry of Health. And it's the Ministry of Health that gives us the priorities that need to be addressed. So there's an opportunity there to put our heads together, government, the FAD and Equity Group Foundation, and change the priorities. Some are a little bit more complex than others, And the last one, though, might say is also we are complementing the government. Remember, we are not trying to replace the government. So the government will also say, yeah, why don't deal with the recurrent costs and we can deal with the expenditure from budget. That's how we had come around, because we could have been confronted with the issue of the beds. But when we started that with the government, we realized that the most important thing was to defend the doctor, guarantee the doctor is protected, because then he'll be available for every Kenyan. And we didn't know how long this challenge will be. We realized today that, yes, we have the vaccine, but it may take another 2 years before every Kenyan has had an opportunity to be vaccinated.
Dr. Mwangi, the COVID Fund Board, what we call the Harambee Board, is made up of captains of industry, people from the private sector, people who deal with the people. One of the things that you know about groups of people is information is very important, especially when it comes to raising money. One of the questions that we keep asking ourselves here on this show is, okay, so this Harambee Fund, they've been asking us to donate. If I go to their website, there's a big button there that says donate now. What are they doing with the money that they have received? Now, it's very encouraging to hear what you've been doing and the plans that you have and the thinking behind everything else. But the question is, why don't you communicate this to the people whom you've gotten money from as often and as clearly as it should be?
Thank you very much. A question of transparency. And that is really at the heart of the private sector. As you rightly said, the captain industry are people, majority of us are from the banking industry. Trust is important, not just to be earned, but to be maintained. And that, as a result, what we did was on the same website, we created the spreadsheets of the amounts that we have collected and amount we spent. But as I said, we allocated out of the 2.7 billion shillings, 1.4 billion shillings was dedicated to PPEs. 500 million was dedicated to safety net support. That is the stipend that we were giving those in the informal sector at the beginning. And the balance was in kind and was distributed to the needy in form of food. So the number has always been disclosed. We received the money the first 3 months, and since then the flow of money has not been steady. So, and that is why I can broadly say about the amount we received and how it was allocated. And the only amount that has not been spent is the money for the health fund. That is the one for our PPEs, because we determined that the doctors will need to be supported for a minimum period of 3 years. And as you heard, we are confident we have money to support them all the way for up to 2.5 years. And that is where the issue of reassigning. We have made a commitment, we have made a promise that we can't break, and that is why the assignment of that money has been a challenge.
Understood. Now, Dr. Mwangi, we'd love to have another conversation with you to look at the number of things that you have done personally, the legacy that you live in this country, that you have created in the country. You've been chairman of the Vision 2030 Delivery Board. You're now participating in addressing COVID-19 response and everything else that you're doing. And we haven't even touched the biggest thing that you also do for the community, and this is the Wings to Fly program, which is really commendable. It has helped very many people. So allow us to invite you again at this time to look at now Wings to Fly, look at governance, look at what else we can do as a country.
Deeply appreciated, and I have now a good experience of the situation room and the conversation. And I hope when you invite me, you make space for me in the room also.
Absolutely.
So that I can have the fun that you seem to enjoy. But let me say that the topics you have picked are very, very central. When I was named the team leader of Kenya Vision 2030, the economy was just $10 billion or 1 trillion shillings in terms of GDP. Today, we are slightly over 10 trillion shillings or $100 billion. We have grown 10 times. And I think it is important to share with that, to inspire our fellow Kenyans, to encourage Kenyans that we are making progress, because it is more about the mindset. And the second thing is about encouraging Kenyans to position themselves for the trickle-down effect of that transformation. So I greatly appreciate that. And it will give me an opportunity, particularly on the Wings to Fly. I think maybe in the next 1 month, we'll be giving 10,500 scholarships. And so it will be very good for us to talk about it, so that the entire nation and need the children understand, so that none of them is left behind before applying for the scholarship.
Asante sana. How is the seat now? We warmed it up nicely for you.
Oh, yes. This is a lovely conversation.
Thank you
Thank you very much.
I've been involved today.
Asante sana. Dr. James Mwangi, Group CEO and MD, Equity Group Holdings, and Chairman, Equity Group Foundation. Speak to you again soon, sir.
Thank you, sir.